Bismillahirrahmanirrahim. I'm Dr. Iqbal and we are going to discuss another topic of microbiology and especially of virology. So we'll discuss today that adenoviruses. So adenoviruses, they are a group of viruses and they can replicate and produce diseases in the respiratory tract, gastrointestinal tract, urinary tract, and in the eye. Many of adenoviruses they cause infection of subclinical type, and sometimes the virus may persist in the host for months. Then about 1/3 of 57 known human there are 57 serotypes of the adenoviruses. Out of these 57, almost 1/3, they cause diseases in humans. Then a few types of adenoviruses, they are used as models for the cancer induction in animals. And another use of the adenoviruses is that they are used as vectors for gene therapy. About the structure and the composition of adenoviruses, that the virus is 79 to 90 nanometer diameter. This is the size of the virus. And the viruses are icosahedral. This is the shape of morphology of the virus, and as you know, the virus is covered by a protein coat which is known as capsid, and in this case the capsid is composed of 252 capsomes, which are the subunits of the capsid. And the important thing is that the virus is non-enveloped. There is no envelope in adenoviruses. Amongst the adenoviruses, a unique component or feature is that they have a structure which is known as fiber, and this fiber projects from each of the 12 vertices or penton bases or the proteins of the capsid. The DNA of the virus is a double-stranded linear DNA, and the genome consists of 26 to 45 kilobase pairs. This is the size of the DNA of the virus. And the virus consists of estimated 11 virion proteins. Now the classification of the adenoviruses is that they are classified into 5 genus, and they are grouped A to G into various groups on the basis of their genetics, physical, chemical, and biological properties. What does adenovirus cause, or how they produce diseases in the humans? The pathogenesis is that the adenoviruses, they infect and replicate in epithelial cells of the respiratory tract, in the eye, in gastrointestinal tract, and sometimes in urinary tract, and that's why they can cause infections. The adenoviruses, they do not spread beyond regional lymph nodes. The group C viruses, they persist as latent infections for years in adenoids and tonsils, and they are shed in the feces for many months. The name of the adenovirus is in fact due to the fact that they are recovered, or initially they were isolated from explants of human adenoids. That's why they are called adenoviruses. The adenoviruses which cause human diseases, mostly they replicate in intestinal epithelium after ingestion, but they produce subclinical infections rather than overt symptoms, except serotype 40 and serotype 41, which can cause gastrointestinal diseases. We come to the clinical findings of adenovirus infections. About 1/3 of the known human serotypes are commonly associated with human illnesses. A single serotype may cause different clinical diseases, and conversely, more than one type can cause the same clinical illness. Adenovirus 1 to 7 are the most common types worldwide, and they account for most instances of adenovirus associated illnesses. Adenoviruses are responsible for about 5% of acute respiratory disease in young children. This is important, that in children, many of the acute respiratory diseases are caused by viruses, and 5% of these viruses belong to adenoviruses. Most of the infections of the acute respiratory tract, they are mild and self-limited, and the virus occasionally causes disease in other organs, particularly in eye and GI tube. In respiratory tract, the symptoms, they include cough, nasal congestion, fever and sore throat. And the syndrome is most commonly manifested in infants and children. And the disease usually involves group C virus is involved in this condition, especially type 1, 2 and 5. Infection with type 3, 4 and 7, they occur more often in adolescents and adults. So in children, type 1, 2 and 5 are important of group C viruses. Then again in respiratory tract, type 3, 7 and 21, they are thought to be responsible for about 10 to 20% of pneumonias in children. And the mortality rate of pneumonias because of adenoviruses is up to 10% in young children. There is another type or another group of adenoviruses of the type 4, 7 and type 3. They cause acute respiratory disease syndrome in military recruits, and the syndrome is characterized by fever, sore throat, nasal congestion, cough and malaise. And the condition sometimes leads to pneumonia, and it becomes epidemic from time to time in young military recruits under condition of fatigue, stress, crowding soon after the induction. The adenoviruses can also cause eye infections. In the eye, the infection is mild ocular infection and maybe part of the respiratory pharyngeal syndrome caused by adenoviruses. Another condition which is known as pharyngoconjunctival fever. It occurs in outbreaks in children's summer camps, and it is also known as swimming pool conjunctivitis and mainly associated with type 3 and type 7 adenoviruses. And the duration of the conjunctivitis is 1 to 2 weeks, and complete recovery occurs, and there is no lasting sequelae. The eye infection, a more serious disease is keratoconjunctivitis, which is caused by type 8, 19 and 37. Now you can see that various types can cause various, the virus represents various diseases or clinical conditions. Now this keratoconjunctivitis mainly occurs in adults and it is highly contagious. The adenoviruses can remain viable for several weeks on sinks and hand towels, and they may be the source of transmission. The fomites like towels, handkerchiefs, and they are found in the sinks. The eye infection or the keratoconjunctivitis is characterized by acute conjunctivitis, and this condition is followed by keratitis. The keratitis is the infection of the cornea, and this usually resolves in 2 weeks, but it may leave subepithelial opacities in the cornea for up to 2 years. Adenovirus infection of cornea induces inflammation through interaction of viral capsid with host cells. So many of the adenoviruses or various types of the adenoviruses, they can cause GIT symptoms, and the adenoviruses, they replicate in intestinal epithelial cells, and they may be present in stools, but the presence of most serotype is not associated with GIT symptoms. There are two important serotypes, 40 and 41, which have been thought to cause infantile gastroenteritis, and they may account for 5 to 15% of gastroenteritis in young children. And this adenovirus type 40 and 41 is abundantly present in diarrheal stool. Adenoviruses can also cause diseases in immunocompromised patients. The most common problem caused by adenovirus infection is in transplants, where the virus causes respiratory disease, which may progress to severe pneumonia and disseminated infection. And this may be fatal. Usually the type 1 to 7, these are involved in these complications. The adenovirus may also cause infection in children who receive liver transplants, and in this case the condition or the adenovirus, they may develop hepatitis in the allograft. One of the causes of the hepatitis in the liver transplant is adenovirus. And so is the case with heart transplants, where they cause myocardial infections, and these are at high risk of graft loss. It means that the graft can be rejected due to these viral infections. The adenoviruses, they also cause hematopoietic stem cell transplant infections, and they cause a variety of infections. They also cause infections in acquired immunodeficiency syndrome or AIDS patients, and in this case they cause GI symptoms like diarrhea, etc. So in case of AIDS, one of the causes of the diarrhea might be adenoviruses. Then adenovirus type 11 and type 21, they may cause acute hemorrhagic cystitis in children, especially in boys. And in this case, the virus is found in the urine. So these were the clinical features of the adenoviruses which are caused. Now, how the immunity develops in the infection of various types of adenoviruses. Adenoviruses induce effective and long-lasting immunity against reinfection. It means that the chances of the reinfection are less. And this may reflect that the adenoviruses also infect the regional lymph nodes and lymphoid cells in the GI. In case of adenoviruses, resistance to clinical diseases appears to be directly related to the presence of circulating neutralizing antibodies. And these antibodies, they persist for life. It means that the immunity may be lifelong against a specific type or a specific serotype. Although type-specific neutralizing antibodies, they may protect against disease symptoms, but they may not always prevent reinfection. So adenoviruses immunity against adenoviruses may be due to the maternal antibodies against respiratory infections. Neutralizing antibody against one or more types have been detected in more than 50% of infants 6 to 11 months of age. And normal healthy adults generally have antibodies to several types. A group reactive antibody response is different from type-specific neutralizing antibody. That immunity against this group reactive antibody is different from specific neutralizing antibody, or the immunity may be against a group of antibodies. And this immunity may be measured by complement fixation, which is a serological method of diagnosis, immunofluorescence, or ELISA. Group-specific antibodies, they are not protective. They decline with time and they do not reveal serotypes of previous viral infections. It means that the immunity, specific immunity is important in this case. So what are the methods of lab diagnosis of the adenoviruses? In case of suspected infection of the adenoviruses, The samples should be collected from the affected sites early in the illness to optimize virus detection. And depending on the clinical disease, the virus may be collected from respiratory samples like throat swabs or nasopharyngeal swabs, from the conjunctiva, throat swabs, and blood, stool, and urine can be collected. Then the duration of adenovirus excretion varies among different illnesses. It is 1 to 7 days in case of respiratory samples of adults with common cold, 3 to 14 days in throat, stool, and eye for pharyngoconjunctival fever, 2 weeks in eye for keratoconjunctivitis, 3 weeks or 3 to 6 weeks in respiratory samples, throat, stool of children with respiratory illness, and 2 to 12 months in blood, urine, throat, stool of immunocompromised patients. So the virus can be isolated by virus culture methods, and the virus is cultured primarily on human cells, and one of the examples is human embryonic kidney cells, which are most susceptible. But these are difficult, and these are done in reference labs. These are not the method of routine diagnostic procedures. Then again, established human cell lines such as HEP2, HELA, KB, they are sensitive, but they are difficult to maintain without degeneration for the length of time required to detect some low-growing natural isolates. Another method is the isolates can be identified as adenovirus by immunofluorescence test using anti-hexon antibody. This is another method of antigen-antibody reaction which is detected by immunofluorescence method. Another serological test is heme agglutination inhibition test, which is done for those viruses which have heme agglutinins on their surface. Then the viruses can be cultured in shell vials. There is another technique of culturing of the viruses, in which the viral specimens are centrifuged directly onto tissue culture cells. These are just the methods, just to remember the names. Now the most important sensitive and specific method of the viral infections diagnosis is polymerase chain reaction, or PCR, and this is routinely used for the diagnosis of adenoviruses and for other viruses as well. So this is done in respiratory samples, in blood, in tissues or body fluids. Now in this case, by means of polymerase chain reaction, the DNA of the virus is extracted and then it is amplified thousands or millions of times. Another method is, in case of fastidious enteropathogenic adenoviruses, direct examination of the fecal extract can be done by electron microscopy or by ELISA or an agglutination test which is known as latex agglutination test. Sometimes the virus is recovered from the eye, lung or genital tract, which is diagnostic of current or acute infection. In the routine lab, what we do is that serology is done. And in case of adenoviruses, complement fixation test or a method of complement fixing or fixation is a method of serological test which is important in case of adenoviruses. And in this case, infection of humans with adenovirus type stimulates a rise in complement fixing antibodies to adenovirus groups shared by all types. Now this means that it detects the group antibodies, not the specific serotypes. Complement fixation test is an easily applied method for detecting infection by any member of adenovirus group, although the test has low sensitivity because it does not detect serotypes, but it does give a clue to the infection. Now in case of antibody tests, a 4-fold or greater rise in complement fixation antibody titer between acute phase and convalescent phase indicates recent infection. This is known as when the patient, when the sera is taken in pair, which is known as paired sera. When the two samples at different times with a week or 10 days interval are taken and there comes a 4-fold rise, it gives the indication of acute infection. Now these antibody test methods, they give a clue to a group of the adenovirus infection. If specific identification of patient's response is required, antibody neutralization or heme agglutination inhibition test can be used. Now these are specific for the serotypes. Heme agglutination inhibition test. The neutralization test is the most sensitive. In most cases, neutralizing antibody titer of infected person shows a 4-fold or greater rise against the adenovirus type recovered from the patient. So these were the few examples of lab diagnosis. Now we come to the prevention and control. Since there is no antiviral treatment, the infection can only be prevented, and there is no vaccine for the masses. Only a vaccine has been developed which is used for military personnel in the United States. So the infection can be prevented by hand washing, surface disinfectants like bleach, use of paper towels, and in case of to prevent infection from the swimming pools, chlorination of the swimming pool is required. So this was a brief description about adenoviruses, and go through the books and let us know if there are any queries. Thank you very much.